All right. Well, good afternoon and welcome to COVID Ethics Update, a service of the Center for Practical Bioethics in this time of pandemic. We welcome you to this next in the series, and we've got a great interview for you this afternoon with a good friend of the center, Dan Manley. He's been working with us over the course of probably the last 15, 20 years, maybe even before that. Dan is in emergency management. And one of the things that prompted me to ask him to participate in today's COVID Ethics Update is a lot of us don't have a lot of interaction with those folks in emergency management. We come at this either from an ethical perspective as a professional or a healthcare professional that's in the throes of dealing with patients on a face-to-face basis, either in long-term care or in possibly in the hospital. But we really don't understand the role and the importance of folks in emergency management, crisis intervention, response and preparedness in terms of emergencies and disasters, as well as we should, and maybe we would prefer not to know simply because it's a difficult thing. But I think it is important for us to get a perspective from them in terms of the responsibilities that we have as good citizens in being able to make sure that we enhance the efforts that they are assigned to protect us with. And so I extended this invitation to Dan today to join us because I think he has a really thoughtful way of sharing his work. And I think he really has a really insightful understanding of kind of the roles that the general citizenry can help in terms of being able to help mitigate some of the challenges that we face in this very difficult time. So Dan, welcome. I'm glad to have you here. Tell us a little bit about your work, where you kind of make things happen in this region, in the Kansas City region, and the role that you play in responding or preparing and responding to the COVID pandemic as it's currently kind of laid itself out in the greater Kansas City region.
Well, John, thank you. I really appreciate the opportunity to be here today and really appreciate the work that you and the center do for our community. A little bit about how I became involved in this. I've been a firefighter in Lee Summit for 37 years. Became a paramedic 30 years ago. And through my career, I've had kind of a diverse path. I started working in hospitals and as a paramedic in the emergency department. Did that for about 30 years while working as a firefighter in our community. So I kind of learned the diversity in the different environments, from the public safety to the healthcare facility roles and responsibilities. Because of my career path within the fire department, I was promoted to captain and started doing work with our hazardous material and technical rescue teams. And so that carried over into the hospital environment. Because of those experiences, I was asked to help develop some of those programs within the healthcare facility, and that evolved into emergency management. And the role I serve today within the Lee Summit Fire Department is I'm an assistant chief, and I'm in charge of the emergency management division. While I was going through my career in the fire department, I worked at Mid-America Regional Council for 10 years. And during that time, I was in charge of the healthcare program management area. And so I had the opportunity to work with hospitals, public health, and emergency medical services to help develop emergency management capacity and capability. So the ability to prepare, mitigate, respond, and recover to disasters from a healthcare perspective was the focus. And so I got to work with the center as we were doing some pandemic planning back in the late 2010 timeframe. And so great opportunity, but the value that you see is everybody has a different perspective depending on their role and responsibility with emergency management, depending on the type of disaster you're dealing with. And the opportunity to be a first responder and seeing the impact on the individuals in our community was a opportunity for me because it gave me perspective working with people that were in hospice care when they were dealing with end-of-life issues, just seeing the entire cycle of life and how we can influence change. So with that, being able to look at emergency management, it gave me an opportunity to be able to see how we can develop systems to help support our vulnerable populations within the communities. And so that was really, in the time that I worked at Mid-America Regional Council and the work that I do in emergency management, that's a lot of the focus, being able to identify the impacts, the stresses that are created in our communities and how we can implement strategies and solutions to reduce those impacts and help bring resources to people that have a need in that critical time.
Yeah, I remember in 2009, which is really the H1N1, when we worked with you guys and a variety of other folks in the region around preparing for that particular pandemic, and it kind of washed out, and it didn't have the same impact, obviously, that this one has. And I was, and maybe I was naive at the time, but it seemed to me that we had a kind of a more hierarchical, structured plan or response. I guess, design in place, and that this is kind of seen to be a little bit more at the level of coordination as opposed to the level of management. So, and I know your role is really in that management arena and not so much on the coordination side. So can you talk a little bit about the difference between, and I don't necessarily think I probably had a perfect understanding of H1N1, but the kind of this sense that we've really not done the best job of kind of marshaling resources in the urgent way that we've needed to this time around. And a naive person like me thinks, well, that's because somebody wasn't in charge and really taking command. And at the same time, it's like, yeah, but there has to be this diffuse, coordinated effort so that everybody can share and make things work. So talk a little bit about the difference between coordination and management, and maybe the historical difference between 2009 and 2020.
Sure. Well, I guess when we look at the different roles within government, the local responsibility, we have a local emergency operations plan that lays out our framework and how we're going to be managing the incident. We base our incident priorities on life safety of the public, how we can stabilize the incident, and how we can recover from the event, return to normal. When we look at the resources locally, we have authority because of ordinances in our community to take certain actions and emergency provisions. When you're at a regional level with coordination, you don't have that authority. You have the ability to help marshal resources and help provide resources to the local jurisdictions in the area. So more of a big brother trying to help provide that added support that may be needed. The other difference here is that when we talk about a natural disaster like a tornado or a flooding event, it's a certain geographical area that's impacted. When we're dealing with something like the pandemic, it doesn't follow geographical boundaries. It's a regional impact. So we have to be able to collaborate and share resources and information to be effective in our response. You bring up a good point in talking about the preparedness and the H1N1 activity and Ebola and some of these other events. Because of those preparedness activities, we have plans in place that give us a framework to be able to change what strategies we need to as we're dealing with a new emerging infectious disease. Some of the things that were very helpful for us is that we had stockpiled resources in the region to be able to help us with that initial response. The challenge that we had as a part of the COVID response is that when we had those stockpile of resources available, that helped us to get through the initial operations period. But because of some of the activities that we were dealing with at the international level and then the national level, the supply chains and the normal ways that we access those resources were locked up. We weren't able to access resources the way we normally would. And so that became a challenge because what it did is then it created a scarce resource situation. Then we have to make modifications in how we respond to incidents to be able to protect our personnel and the public, utilizing a plan that recognizes we have scarce resources that we have to consider in our deployment.
Yeah, that's a really good understanding for me to be able to say, because it was pretty clear to me at H1N1 that we knew what we were doing. We had these really elaborate plans about how ventilators were going to kind of march across the United States, following the disease. And there was an expectation too that it would begin on the coast and move inward and that kind of thing. And this kind of just exploded, in Washington, and then New York, and then, New Orleans. And I mean, it was all over all at once. And then it just was such an insidious mode of transmission that it made it much more difficult. And I think those of us, again, with maybe a little bit of a lack of appreciation for the challenges that you guys face when those kind of avenues of delivery just get dried up or taken away from you. It's not something that is expected. And yeah, there may be plan B, but it certainly doesn't look like plan A. And so I appreciate that. Tell us a little bit about kind of the mitigation work that you do, and then kind of the expectations that you have of us as citizens, as community members, in basically helping you get the job done so that we do benefit from the fact that we're doing the suppression, doing the containment that's necessary for us to be able then at some point to say, hey, we can go outside again.
Well, really appreciate the opportunity to address that, because I think that is huge when we're talking about a pandemic. With the pandemic, we know that we're dealing with a novel virus as opposed to what we see through influenza season each year. The impact or the risk from a novel virus is that we have to characterize the threat of that virus. It's something that hasn't been experienced. We have to be able to identify information about how we can develop vaccinations and other resources that will help us protect the welfare in our society. And so, in absence of having a vaccine that can give us immunity from the threat of the virus, and without having medications that can treat the virus or the impacts, we're left to supportive care and mitigation strategies to help reduce the risk and the spread of the illness. And so, we started very early with the mitigation strategies in our risk communication, saying that, the way to avoid this is social distancing. We need to go ahead and make sure that we're washing our hands regularly, make sure that everybody's washing it the appropriate amount of time, make sure that we're following appropriate respiratory hygiene, coughing, covering our coughs, and those activities. The mitigation, and also disinfecting surfaces. As the threat started to increase in the region, that's when you started seeing the limitations on the large gatherings, because those groups where you would have close contact really increased the risk of spread with the virus. And so when the executive orders started coming out through the community, it was to help implement those mitigation strategies so that we could reduce the risk of transmission of the illness through the community. The bigger concern there was that we know that the high-risk populations in the COVID-19 case definition are the ones that are at greatest risk to be hospitalized, require ICU admission and ventilator support. And so by us reducing the rate of transmission through social distancing and those executive stays, that we were able to go ahead and decrease the capacity on the hospitals and allow more treatment capability to support those populations. It was also giving us time to develop clinical resources to help treat or reduce the impact of the illness, such as remdesivir that we're hearing about, or convalescent plasma therapies that are giving people a greater opportunity to survive. So the other part of this process that I think has been challenging is the changing in messaging, because the case definition from day one changed throughout the process. The need for face coverings, the use of masks, that guidance changed as we learn more about the disease and how we should be protecting ourselves from that. So, and I think that's not uncommon to this event. It happens with every type of pandemic response that we've seen. You get more information, it changes how you approach the situation. So going back to the question, my response is being able to listen to the information that's coming from our subject matter experts is very important. And I think that, we've seen that battle. There's a political influence, and then there's a scientific influence on the decisions that are being made. And just to be able to have that communication out there so that the public understands the risk is our job and responsibility in this process.
So I'm going to guess, though, that your preference is that we would be more vigilant and more productive if we were listening to the science rather than the political rhetoric, and so I guess, and we need to wrap this up here pretty quick, but give us your kind of top 3 oughts that we need to be considering, again, as residents in our communities, knowing full well that the folks who are the public health officials are really trying to do the work. You're trying to do the work. How do we show respect for what it is that you're trying to accomplish and keeping us safe? What are the top 2 or 3 things that we can do?
I think the first message is that I think that each of the leaders that you see across the local, region, and state, federal level, I think they all have community interest as their top priority, being able to save lives and help our society. I think the thing that would be most helpful is when we have recommendations that can reduce the risk for others. That's really important for us to listen to because it's not only about your self-interest, but being able to protect others in our society. So wearing a mask, being able to maintain that social distance, you're helping somebody that may be immune suppressed. You may be helping somebody that has an underlying process that nobody has any awareness or visibility of. And because this disease, this virus can transmit so easily, it's really important for us to be considerate of others and try and provide that level of protection.
Yeah. Well, Dan, I want to thank you for joining me today on this COVID ethics update. We are deeply appreciative for the work that you do. I know you are kind of on the front lines along with a lot of other champions and heroes out there. So we deeply appreciate the work that you do and then continue to do your work with Mark and with first responders and the managers and designers of basically how to keep us safe in our homes and communities. So we really appreciate your leadership and your devotion and your commitment to that work. So any parting comments you'd like to make? If not, I'll just go ahead and wrap it up here.
Oh, John, I'd like to say thanks again for the opportunity. And again, I really appreciate the opportunity to work with the center. So much great has been accomplished through your organization, and I'd like to say thank you for that.
Well, thank you. So folks, this is the COVID ethics update, and we deeply appreciate you being with us today for this episode. If you would like to learn more about the center, you can send us a note at covid@practicalbioethics.org. That's COVID, COVID, at practicalbioethics.org. This posting, this particular episode will be aired on our YouTube channel. You can subscribe to our YouTube by going to Practical Bioethics YouTube, and it'll be one of the, I think, 20 or so that we've collected over this time. As you might imagine, the opinions expressed by Dan are not necessarily those of the Center for Practical Bioethics, but they're pretty close, I got to tell you that. So Dan, again, thank you very much for your time today. Keep up the good work and stay well.
Thank you.